Hello everyone, I am Kathleen Joy Pirumpilio, and for today's video, I am going to perform the newborn's cardiopulmonary resuscitation, or the CPR. First is we need to evaluate the newborn's Apgar score, meaning that it's a quick test done at 1 minute and 5 minutes after birth, and it will tell us how well the baby tolerated the birthing process and the Apgar score after 5 minutes, and will tell us how well the baby is doing outside of the mother's womb. Now for the two-turn demonstration, let's just assume that the newborn's Apgar score is 3, which fall within the concerning range, meaning that the newborn is in need of immediate resuscitation. After determining the newborn's Apgar score, we have to check for the baby's responsiveness by tapping the shoulder and rubbing the newborn's soles. Baby, baby! After checking that there's no response, we need to position the newborn on his back and call for help to activate the code blue or doctor squeak to notify the doctors and the nurses. Help! Doctor! Quick! After calling for help, we need to open the baby's airway, so we can do the head tilt and chin lift to still open the newborn's airway, and using a suction ball, suction the mouth and nose to remove the secretions if there are any that are obstructing the newborn's airway. So we have first to tilt the head and the chin, okay, and then after that let's do the suction. And then since the newborn is unresponsive, perform positive pressure ventilation. So there are two types of positive pressure ventilation. We have the invasive using ventilator and non-invasive using pediatric bag masks. So I'm going to use the bag masks. So this is to cover the newborn's mouth and the nose. And we have to place the forefinger of one hand on the rim of the bag to ensure that the pressure seal, and remaining fingers will be placed on the jawline to make sure that our hands is not leaning on the patient's eyes and not compressing the baby's neck. So this is the mouth of the baby. Then using the bag mask, it will deliver oxygen to the newborn, allow 30 seconds of ventilation or 40 to 60 breaths per minute, and see if the chest is rising with each bagging. And then right after that, someone will attach a heart monitor to the baby and pulse oximeter to keep track of the newborn's heart rhythm, and pulse oximeter measures hemoglobin oxygen saturation, and this will help monitor the efficacy of CPR. And then right after performing the PPV and there's still no increase of heart rate, we have to perform chest compression and rescue breaths. So use 2 to 3 fingers and locate the location of the baby's chest compression, which is below the nipple, and start the 30 compression. And then we have to press down the chest for about 1.5 inches only, since the newborn's bones is not strong enough to handle pressure. So now we have to begin doing the chest compression. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. And then give 2 rescue breaths using the bag masks. Repeat the chest compression again after 4 cycles, and if not heat rate after 4 cycles, it's still below if the heat rate is still below 60 beats per minute, continue chest compression and assist in intubation and giving meds. So assuming that the newborn's heart rate is more than 100 BPM, I already done performing 4 cycles of CPR. We can now do the post-resuscitation care, like monitoring vital signs, monitor and maintain the patient's airway. And then right after that, we have to do the CPR. After doing the CPR of the newborn, we have to document all the time, when it started and ended, and given medication and the treatment. That's all.